These cases involve two individuals who reside in the same household, one who recently returned from Italy. Both individuals are isolated at home with other relatives to keep the illness from spreading. In a moment, I'll turn it over to Dr. Kathleen Toomey, the Commissioner for the Department of Public Health, to provide more information on the individuals and the protocols in question. But I want to take a moment to emphasize that Georgians should remain calm. We are ready for today. We've been preparing, as you know, for several weeks now, and so far every development has come forward just as we expected it would. As you all know, this past Friday we formed a coronavirus task force of public and private subject matter experts to pool our resources for preparation efforts. But even before that, Dr. Toomey, our state epidemiologist, Dr. Sherry Drinsick, and task force members have been in constant contact with the CDC and federal partners for weeks now, receiving the latest updates and preparing for every scenario, which includes this one. This morning, our team participated in a conference call with Vice President Pence on the federal government's efforts to prepare for all possibilities. Earlier tonight, I also spoke with the Vice President to inform him of this new development here in Georgia. He emphasized to me that COVID-19 continues to present a low risk for most Americans, but that we must remain vigilant for medically fragile populations, including the elderly and those with existing health conditions. He mentioned that Americans should continue to use best practices for prevention, regular hand washing, avoiding contact with those who are sick, and obviously staying at home if you're not feeling well. He emphasized that efforts to prevent and reduce risk for the coronavirus continue to be backed by the full resources of the federal government. I want to remind everyone again that our team is working around the clock to gather information about these cases, monitor developments, and determine any exposure. We feel confident that our preparations have enabled us to manage these cases appropriately and minimize any risk moving forward. We remain in constant communication with our partners at all levels of government, including the members of the Coronavirus Task Force, and we will continue to update members of the public as information becomes available. With that, I'll hand things over to Dr. Toomey.
Thank you, Governor. I wanted to say that in full transparency, we heard about this case literally hours ago, and we thought it was important that we come today and tell you about this, even as our epidemiologists are still investigating and trying to find any potential contacts in the community. I wanted to say that everything about this situation demonstrates how well the system is working. This individual had traveled to Italy, recognized that there was a potential risk for themselves and their household members, contacted the physician ahead of time so that they would not put any of the other patients at risk in the practice, and were instructed by the physician, an astute clinician who thought about coronavirus when told about the travel history, had them come in through an alternative entrance so that people waiting in the waiting room would not be exposed to any infectious disease, whether it be influenza or coronavirus. This clinician appropriately tested for coronavirus after contacting our epidemiologists on call. We got this specimen on Saturday, sent it to CDC for testing because they are the ones doing these tests currently, and they turned it around in record time. And we got this result back late this evening, and the governor's office heard about it within seconds of my receiving that call. And so I think a few things I just want to emphasize. One, that this was an astute member of the public who recognized the potential risk because of travel. This was not person-to-person contact in the community that created this case. This was a travel-related case. The physician behavior was absolutely what we had hoped for, to think about coronavirus and work with the patient to ensure no other patients are exposed to potentially infectious disease. And we will work very, very diligently to identify any contacts in the community that these individuals may have had. I want to reassure you that they are at home in home isolation with other household members, are doing well, have minimal symptoms, so they're not hospitalized. And we will continue to search for any contacts to ensure that we stop any further spread in the community, because that's our goal. You know, we've identified a case, or 2 cases now in Fulton County, but we don't want that to go any further. And that's why we do contact investigation. And that's going on now, even as we're meeting. Our epidemiologists are at work, and will continue to do so through tomorrow until all the identified contacts have been found. And so I thank you for the opportunity to let you know. But from my perspective, this is a system that we established working well. We knew we were going to have a case, and this couldn't have gone better as far as I'm concerned. And the message to the public is still low risk, no local transmission going on, and wash your hands and get a flu shot. I'll keep saying that every time I see you. So, yeah, thank you.
All right, so we'll open it up for questions if anyone has any they'd like to pose.
Can you take us through the timeline? You mentioned a bit of it, but when these 2 people actually got back into the state, when did they land from Italy, and how soon did they go to see the doctor?
We can't go into the details of exactly when that happened, again, to ensure confidentiality, but only one individual traveled, and that was to Italy, which is one of the high-risk countries. And it was in a matter of days after returning home, developed symptoms.
Doctor, can you describe exactly what home isolation entails?
Sure. I mean, the individuals take their temperature. They're in contact with Dr. Drenzik's office daily. So we are continuing to contact them on an ongoing basis throughout the day on a daily basis, and we'll continue to monitor them to ensure they're doing well. And eventually we'll take another test, a series of tests, to ensure that they are negative before they can go back out into the public.
I think this is one thing that's, you know, really, I think, critical for the public to be a partner in this, is if they get to feeling bad, if they're having the symptoms, to call their medical provider before they do anything, so that they can have that conversation with them, see what kind of risks that they may pose, and then figure out how to handle that, which is exactly what happened in this case. So, you know, that's one reason we wanted to get the information out tonight, so people continue to hear the message of, if you start feeling bad, don't go out, call your doctor, let them talk it through with you, and develop a plan on how, you know, you deal with that individual scenario. And we've got a lot of resources that are available, and more coming, so that we continue to communicate that with the public.
Is there any telltale signs that distinguish feeling bad versus the flu feeling bad?
Well, I think the real telltale sign here is that the individual had been in Milan. And I think that right now, particularly in Georgia, if you've traveled to Milan, if you've traveled to South Korea, if you're coming home from China, that you're much more likely to have encountered coronavirus there than anywhere in Georgia, because at present time we know of no other cases.
To clarify,
Excuse me? Again, we aren't disclosing that this time to ensure confidentiality.
they were never at the hospital though. They
No.
contacted the doctor and then they're.
We're seen in the doctor's office, tested, and have remained in home isolation with their other household members.
And we were just at the airport, actually covering this when you guys sent this out, and kind of covering the protocol part of when travelers are leaving the country, coming back to the country. And I understand that the president even tweeted, I think, on Sunday about if you're coming from at least one of those high-risk countries, that you should be at least monitored on the front end and on the back end. Do y'all have any guidance? Because we actually talked to some passengers that were coming from Italy that didn't get tested, and then some passengers tonight that were coming from South Korea that did. So it just, I don't know if there's a consistent protocol, or or what any guidance y'all can offer on that.
Again, if you have no symptoms, there'd be no reason for you to think about getting tested. And right now we have, as we've talked about before, are working very closely with CDC, and we're following CDC guidance in everything we do. At this present time, we are not receiving lists of names of passengers from Italy and South Korea the way we still are receiving lists of names of passengers from China. And that's just the way the system is set up.
Well, just like the screening process, like on the front and on the back end from these high-risk countries, other than just like testing your, temperature. I didn't know if there was a standard protocol for that.
To my knowledge, there isn't at the airport at the present time, unless you, Dr. Benson, know about that. I do not know about that happening currently. And again, what has been set up has been largely for the individuals returning from China.
I will say that I did talk to the Vice President tonight about the travel history of this one individual, and he assured me they are very well aware of that and are looking at that very hard. So I know him and the President both, and he will certainly be keeping us updated on that.
Is there a plan in Georgia if there are more cases, like a motel or a place to isolate patients going forward if there are other cases besides these two in Fulton County?
Well, we hope to be able to isolate the majority of individuals who are Georgians in their home, because that's safe. It's safe for the public, and it's most comfortable for them. And we will explore other options as necessary. But right now, that's our plan, and that's the recommended plan by CDC.
Yeah, and I mentioned, so I guess it was a couple of days ago, I believe it was. We've also been looking, far out for all the what ifs, preparing for the worst and certainly hoping for the best. So, this isn't something that we're just now thinking about. A lot of these things, the people standing behind us have been working on those issues and thinking about those issues for several weeks now.
Do these patients do in fact live in Fulton County?
Correct.
And can we confirm that they flew into Hartsfield-Jackson?
One individual.
That's
And I have no idea whether it was a direct flight or what. We don't have that information at this time. This is late breaking news. I mean, literally for us as well, and we're still doing our investigations.
What steps are being taken to communicate with the other passengers on the plane that this person flew on?
Well, this individual wasn't symptomatic on the plane,
Right.
and so we don't believe he was infectious. I think the infection, when it occurred, was in Milan, and everybody who is in that part of Italy at this time should be aware that they are at risk for exposure to coronavirus.
Do you expect these to be the last two cases you deal with?
I suspect we'll see other cases, and I hope all of them go as smoothly as this did, with early recognition, both by the patients themselves of their potential risk, and the very astute clinician who got on this immediately, took precautions within their office, and called us immediately. And we were able to take action and facilitate things at CDC for rapid testing. And remember, by Friday, we will have the capacity to test in our own public health lab, which will allow this to turn around even faster.
And Doctor, just to clarify, one man was traveling, and then the other person in the same house?
In the household,
Got it.
correct.
All right, thank you, everybody. If you
All
have
right,
any
thank
additional
you.
questions, we'll get with you after.